Namaskar. Myself Dr. Amit Goswami. I am a consultant in minimal access and bariatric surgery in Manipal Hospital, Bihar, Gurugram. Today, I am here to discuss some medical facts about a common clinical entity, that is hernia. After the discussion, hope it will help you in clearing your myth regarding the hernia ailment. Now, first of all, let us discuss what is hernia. Hernia is outward protrusion of the contents in the abdominal cavity through some weak spot in abdominal wall. We do have few weak spots in our abdominal wall like umbilicus and groin. It makes them susceptible for hernia formation. However, there is another form of hernia that can form over a previously operated site. As all of you know, when we operate, we make cuts in the abdominal wall. Even after meticulously repairing the wound, the strength of this place cannot be at par with the normal skin. That's why it makes them susceptible for hernia. The other name for cutting over the abdominal wall is incision, hence it is also called incisional hernia. Now, when can you suspect that you are having hernia? If you notice a newly formed bulge or swelling as the site mentioned previously, or if you have undergone surgery previously, you are noticing some bulge over there, you should immediately consult your surgeon. Hernia is generally diagnosed clinically. However, ultrasound is most commonly done for its diagnosis. Now, there are many myths regarding the treatment of hernia. Contrary to the popular myth, we don't remove any part in hernia surgery. What we do, as we have already discussed, the contents were going out through some weak spot in abdominal wall. So during the surgery, the contents are reduced in its original place, and against that gap, the surgeons place a sheet of some synthetic material that is clinically called mesh. I will give a common analogy. Suppose you can make a wall with stone and brick, or you can use cement. When you use cement, it becomes more stronger. Likewise, when the mesh is placed against the gap, then tissue grows over it and ultimately the gap closes. Nowadays is the days of laparoscopy or minimal access. Now, if we consider laparoscopy, what is its main advantage? In laparoscopy, we make very small tiny cuts over abdominal wall, and through some tiny cuts, we operate in any part of the abdomen. Like in hernia also, laparoscopic hernia surgery is the treatment of choice. Around 3 cuts are needed for hernia surgery. Generally, the duration of hospital stay is 1 day, and from surgical perspective, there is no restrictions of your day-to-day course after the surgery. The young patients can be admitted even on the day of surgery and can be discharged on the same day. Now, one most important question is, what will happen if you don't undergo surgery? As we have already discussed, hernia is the contents protrusion through some weak spot. So there are certain conditions which make the persons more susceptible for hernia formation, like a person is having cough, a person is having prosthetic enlargement, a person who is a smoker, or a person who has constipation, to mention few. In such conditions, the contents, large amount of contents move outward, but it cannot come back. So the gap gets constricted and it jeopardizes its blood supply. So ultimately what happens, the contents of the hernia get obstructed or in absence of blood supply, it gets strangulated. So this is a dire emergency. So when you know that a hernia can be very easily and effectively treated with laparoscopic surgery, so you need not wait to complication to happen. And again, contrary to the popular belief, there is nothing that smaller hernia cannot be repaired. Rather, hernia is better repaired when it is small. This is much for today. Thank you so much.